Which of the following is the name of the modified endoplasmic reticulum found in muscle cells? A. The sarcomere. B. The myoplasmic reticulum. C. The T-tubule. D. The sarcoplasmic reticulum. The answer is D. The sarcoplasmic reticulum. Muscle cells have a specialized endoplasmic reticulum called the sarcoplasmic reticulum. The sarcoplasmic reticulum regulates the calcium ion concentration in the cytoplasm of striated muscle cells, and so plays a significant role in muscle contraction and relaxation. The T-tubule is a specialized invagination of the sarcoplasmic reticulum, and the sarcomere is the single contractile unit of a muscle fibril. There is no muscle structure called the mycoplasmic reticulum. The articulation between the intervertebral disc is what type of joint? A. Synovial. B. Synarthrotic. C. Cartilaginous. D. Diarthrotic. The answer is C. Cartilaginous. The intervertebral disc articulate with the vertebrae via cartilaginous symphysis joints. These joints are amphiarthrotic, meaning that they allow for slight mobility. Synovial joints are all diarthrotic and characterized by a flexible joint capsule filled with synovial fluid. Synarthrotic joints have no movement. Examples include the skull bones and the joints of the teeth to the jaw. The head of the femur articulates with what structure of the hip joint? A. The obturator foramen. B. The glenoid fossa. C. The acetabulum. D. The patella. The answer is C. The acetabulum. The head of the femur articulates with the acetabulum, a concave surface on the pelvis formed by the union of three bones, the ilium, the ischium, and the pubis. The obturator foramen is a large opening in the pelvis formed by the pubis and the ischium bilaterally. It does not form any joints but rather allows the passage of the obturator artery, nerve, and vein. The glenoid fossa is the surface onto which the head of the humerus articulates in the shoulder, and the patella is a part of the knee. Which of the following structures is a type of synovial fluid sac between bones and overlying tissues? A. Ligament. B. Tendon. C. Bursa. D. Capsule. The answer is C. Bursa. Bursae are synovial fluid sac between bones and overlying tissues. They provide a cushion between the bone and tendons or musculature around them, allowing for reduced friction and painless movement. A tendon is a connective tissue point of attachment of muscle to bone, while a ligament is a connective tissue attachment from bone to bone. A capsule is a fibrous, fluid-filled structure surrounding a synovial joint. Individuals who grind their teeth are at risk of causing damage to which of the following joints? A. The temporomandibular joint. B. The xiphoesternal joint. C. The pisotrictal joint. D. The intermetacarpal joint. The answer is A. The temporomandibular joint. Bruxism, or involuntary tooth grinding, can cause inflammation and damage in the temporomandibular joint, which is the articulation between the condyle of the mandible and the temporal bone. The xiphoesternal joint is between the xiphoid process and the body of the sternum. The intermetacarpal joints are formed between the metacarpal bones of the hand, and the pisotrichterral joint is between the pisiform and trichrum of the wrist. Which of the following is a term for movement along a sagittal plane that decreases the angle between bones? A. Adduction. B. Abduction. C. Extension. D. Flexion. The answer is D. Flexion. Movement along a sagittal plane that decreases the angle between bones is flexion. This is in contrast to extension, which is movement along a sagittal plane that increases the angle between bones. Adduction is movement that pulls a structure toward the midline of the body, while abduction moves a structure away from midline. Which of the following joints is capable of circumduction? A. The sacroiliac joint. B. The elbow. C. The knee. D. The shoulder. The answer is D. The shoulder. Circumduction is movement that produces a circular motion with the distal end of a body part. True circumduction allows for a 360-degree range of movement. Of the joints listed, the only one capable of circumduction is the shoulder. Which of the following is an example of a cantaloid joint? A. The metacarpophalangeal joints. B. The acromioclavicular joint. C. The humeroideal joint. D. The glenohumeral joint. The answer is A. The metacarpophalangeal joints. Cantaloid joints are a form of synovial joint in which a cantile rests in an ovoid cavity. Of the joints listed, the only cantaloid joint is the metacarpophalangeal joints, the joint of the most proximal knuckle. The acromioclavicular joint is a plane joint, while the glenohumeral and humeroideal joints are both ball and socket joints. The patella articulates with which of the following bones? A. The tibia and fibula. B. The tibia. C. The fibula. D. The femur. The answer is D. The femur. The only bone that the patella, or kneecap, articulates with is the femur, at the patellofemoral joint. The patella is a sesamoid bone, meaning it is fully embedded within a tendon. The patellar ligament joins the patella to the tibial tuberosity, but not the fibula. Which of the following are three structural classifications of joints? A. Synarthrosis, epiarthrosis, and diarthrosis. B. Cantaloid, gliding, and hinge. C. Sutures, synsmosis, gomphosis. D. Fibrous, cartilaginous, and synovial. The answer is D. Fibrous, cartilaginous, and synovial. The structural classification of joints divides them according to the form of tissue that connects bones to each other. The three structural divisions of joints are fibrous, cartilaginous, and synovial. In contrast, synarthrosis, amphiarthrosis, and diarthrosis are all classifications of a joint's movement. Cantaloid, gliding, and hinge joints are all types of synovial joints, while sutures, synsmosis, and gomphosis are all types of fibrous joints.